Good morning. Welcome to the Shine Conference 2021. I'm Nadine Rosenblum, a member of the Center for Nursing Inquiry, and I am speaking this morning with Lisa Klein. Good morning, Lisa.
Good morning.
Where do you work and what is your role?
So I am the clinical nurse specialist in the Department of Neurosciences on Zia 12 East, Zia 12 West, and that includes the Epilepsy Monitoring Unit, the Brain Rescue Unit, and the Neurosurgical IMC.
Wow, that sounds like a lot of work. So I'm thankful that you're taking some time to speak with me this morning. So it sounds like you had a big EBP and quality improvement project, and now you are working on a publication. Tell me about your project.
Correct. So the project started back in about 2017 when our Neuro Inquiry Committee, which is an inquiry committee just based on neuroscience nurses from 12 East, 12 West, and NCCU. And we had an EBP question asking what are the best practices for bladder management to prevent CAUTI and or UTI for retention and or following indwelling urinary catheter removal. Since there's a lot of literature showing for CAUTI prevention, we want to a little bit know how do we prevent UTIs for patients that have retention or following Foley removal. And from the EBP, we found results that had fairly decent good evidence, but they really were conflicting. And nothing was really standardized and was across the board considered this is the care we should be providing. So we presented our EBP at Nursing Scholars Day that same year. And since then, we planned a QI project. With the QI project, we had to make sure we had physician champions since we were trying to really increase nursing autonomy with having nurse, drive bladder management. We also required champions on our units. And then for our quality improvement, because we're asking nurses to do interventions on patients, we also required build-in Epic of orders so that we can manage these patients without providers putting in the orders. And of course, our QI project beforehand included doing some staff education. We made sure we collected baseline period data before we did the staff education. So that was from May to October 2019. We did staff education in November, and then we went live with the QI pilot starting in December of 2019. What we learned from the QI project is part of our education rollout was on the algorithm, and we had a My Learning for staff to do case studies to utilize the algorithm. And what we found was we got a lot of feedback that staff were very confused. So I'm going to show you here. So on the left are two algorithms from articles we used for our study, and both of them are very similar flow chart. And our original algorithm looked much like the one in the middle. And we got a lot of feedback from staff that it was very confusing. So we took that and moved it to a chart on the right-hand side. And this has been our algorithm since then. And our staff received a lot of feedback. The staff much more thought this was much easier to understand. That's a big part of QI, is that when you're doing an intervention, even though we got human factors involved to create the flow chart, it was not user-friendly in the end. So we made a very simple table for that as well. So with the QI pilot, the results we did when we compared the QI period to baseline, so we had about 119 patients in the baseline period and 115 in the QI period. We found that we had 34% compliance with the algorithm at each intervention point for each patient in the 6-month pilot period, with 53% compliance during the last month. So as we went month to month in the QI period, we improved with nurses' compliance with the algorithm, okay? And of course, we were sticklers on whether something is considered on time and whether the right intervention was done. So I'm not surprised that the rate of compliance with every portion of the algorithm was not higher, but it is something that, whereas we're continuing this QI project, now we're going to move to a health system perspective. This is something we're going to continue to try to build on, is improving that compliance with the algorithm. We did have an improvement in the proportion of patients that had bladder management following Foley removal. We had only about 25% baseline compared to 70% during the pilot period. More patients also during the pilot period were actually discharged with the Foley catheter, and this also impacted Foley days. So we also ended up having just slightly average Foley days of 1.6 during the pilot period compared to 1.3 in the baseline. But more patients are being discharged with the Foley is going to create more days with the Foley. We also found no change in the rate of treated UTIs during admission or while in the acute care units. We had no change in the length of stay, falls, change in patient's mobility, or patient disposition. And what we found was that our nurse-led bladder management protocol approach was not inferior to prior practice. And so it's sort of exciting that we're going to move this to the health system and also work on improving compliance and improving our algorithm.
That sounds like a great outcome for all that work. And it's very exciting to hear that your unit-based original EBP question is turning into a health system impact. So that's very exciting. So what are you going to do with all of this information now?
So our plan from the beginning has been that we're going to publish this. And so before we even started the QI implementation, we went and submitted an e-form Q to the IRB to have them agree that we're not doing human subjects research and that what we were doing was quality improvement. Mm-hmm. So we've always planned to do publication.
That's great. Are you doing all of this writing on your own? Who's working with you on the manuscript, and how are you sharing the work?
Sure. So I had a discussion. So I have a physician mentor who's been our QI rep for the Department of Neurology, and he is mentoring me through the writing process, with the decision being that I'd be the primary and he's going to be the last author on the publication. Who else is joining in on this? So we had 2 nurses help with a lot of the data collection who are interested in joining and helping the writing portion as well. And then we also have our prior nurse informaticist who has moved on to another position, but she's still here at Hopkins and has, from the get-go, because of all the work she put into this, also wants to be a part of the publication. So we'll have 2 bedside nurses, a nurse informaticist, the physician, and we're also going to have had some assistance from our hike reps as well. So we will include them as well. But the brunt of the writing will be me and some of the bedside nurses that are also on our nurse inquiry committee.
That's exciting. It's nice to be able to include the bedside nurses in the publication, especially since they participated in so much of the work. It really is. It sounds like it really is a group team effort, and you're going to get some good recognition.
Yeah.
How did you decide which publications to submit your manuscript to?
So one thing that's nice is through the Welch Library, you have access to either the journal citation reports and Web of Science, and they can, I think Web of Science has this match manuscript, and you can put in just your title, you can put in your abstract, and they use keywords that they pull from that to sort of give you recommendations of journals that might be appropriate for submission. And then when you get that list, you'll find some that are just totally not appropriate. When I was looking, these are a few that I found that are nursing related, that just based on their title, I'm like, oh, these might be appropriate. And it's important that when you look at these, you also want to look at the impact factors. Mm-hmm. And each journal actually lets you know what their impact factor is. And that impact factor is going to tell you what's the, breadth of other people reading these, journals. Because if you have a very low impact factor, so it's a good number if you're closer to 3, but I want to say the average is probably about 1.5, and but the lower you are, the less likely people are actually going to read your work. And so you want to have use a journal that's going to actually have some type of impact in readership. So it's looking at the readership breadth of it. Basically, with these, where we're at, so with the writing, I've started to just sort of write a draft, sort of trying to get the background and the methodology section started. But the key part is, and actually we're working on this, is I've reached out to all of the editors of all of these journals, and reaching out because I want to find out, even though I looked at their About journal on their websites.
Mhm.
So some are a little bit geared towards more research, but then they might lead into a little about nurse implementation. So I reached out to the editors, giving them a little synopsis. I also try to send them an abstract, a sort of draft abstract of the paper to have them help me decide whether it's an appropriate paper journal to submit to. So if it's a if they think it could be a good match, then I have to go to that journal's website to find out what are the guidelines for submission, because I don't want to have it that I write this whole up, but then either the word count or the format of the sections don't match with how the journal will publish. So I try not to write too much until I know exactly which journal I want to try to submit to.
Those sound like excellent tips. I'm sure it makes a lot of sense to make sure that all of the work that you're putting into having done your project and writing it up, you want to have it seen. Writing to the editors sounds like a really good way to get good feedback from them, and knowing that you have their guidelines to use sounds like it'll be really helpful in order to get your manuscript accepted by that journal. So
yeah, and it's really, even if the editor says that it's not a great fit, it's better that now than if I try to publish and submit it to them and it's rejected when I've written it all up, but I've written it for them but not for these other journals that have a different format perhaps. So it's it's very collegial when they say whether it's a good fit or not.
Excellent. Now, have you submitted a paper for publication in the past?
I have, as a primary author. I published in the Nursing Inquiry journal.
Excellent. And how did that process go?
Probably smoother than it should have been, but once I submitted it, they had the 3 reviewers look at it and gave us feedback on some adjustments to make for it. But it really was not huge drastic adjustments to meet their needs, and then it was accepted for publication. So but both this article that I'm working on, and I have a physician mentor to help me with the writing of it. I also had for the other one, it was about mobility, and I had a physical medicine and rehab physician here who also mentored me with that. So I find that to be very helpful. Excellent.
So you've got a little bit of experience writing papers for publication, and you're familiar with the process in that sometimes it also includes a little bit of feedback and rewriting, but that doesn't necessarily mean they don't want your paper. They're just trying to help you make it as best you can.
Right.
Excellent. So this is a great lot of information that you are sharing with us today. Is there anything else that you feel like we need to know about taking a project from the question to publication?
I guess the other thing is we do have a policy at the hospital that your director of department needs to, before you submit it for a submission for publication, your director of your department has to sign off on it as well. Because, we're submitting something representing Johns Hopkins Hospital, Johns Hopkins Nursing. And so you have their support with your submission as well.
That's good to know. All right. Thank you for taking your time with us today, this morning, Lisa, and good luck with your publication and your project.
Great. Thank you. I'm happy to be here.
All right. Take care.
Bye.